Aptiom is our drug for partial onset seizures. It's currently approved as an adjunct to treatment, and we have very significant monotherapy data with Aptiom that we're very excited to share today. This drug is a voltage gate sodium channel inhibitor. Big word, but essentially what it does is it reduces the activity at the level of various neurons to stop or inhibit the seizure from occurring or even spreading. Now, as you know, partial onset seizures can happen anywhere in the brain, and sometimes it could spread and even become full-blown tonic-clonic type seizure. There's mortality associated with it as well, so this is a very substantial need. Well, as you know, partial onset seizures is one of the most common type of seizures, and it's a very significant disease that affects over 2 million people in the United States. It's a significant burden for those folks because these people cannot hold down jobs often. They can't drive. It affects their social life, their family life. There's a very substantial unmet need. And many patients are not treated adequately with the current regimens that they're on. In fact, over 30% are not adequately treated, which means they're still having breakthrough seizures. And these seizures are very difficult to control. So it's very important to fulfill that medical need, and at Synovian, we are dedicated to the field of epilepsy as well as to other CNS disorders. We now have data on monotherapy, which is really very important. This is the usual projection for many treatments, although there aren't many anti-epileptic treatments available for monotherapy right now, and that's what makes this data so important. This is approved in adults, and we are currently doing pediatric studies to satisfy FDA requirements as well. Well, this was approved in 2013, and so neurologists and other doctors have been using this during that time. They're getting comfortable with the drug. We get good reports from the field in patients who are treated using this as an adjunct, which is what it's indicated for. I think that physicians are looking forward to monotherapy because, as noted, they also are very concerned about patients who are on multiple treatments. Patients who are on multiple treatments are also getting a whole host of side effects. So whenever there's monotherapy data, there's excitement, and I think we've generated a lot of excitement at this meeting as we show our monotherapy poster presentations. So at this point, we submitted our application, and we should be hearing again in the third quarter of this year from the FDA, and we're anticipating a good interaction. The data are excellent, and we're hoping for an approval because patients are at the center of what Synovian does, and we need to add this treatment to the armamentarium. So we're looking very much forward to moving forward in our discussions with the FDA.